Cookeville Regional Medical Center, the Upper Cumberland's proven choice for healthcare. Here's Jill Bowling.
When a person is diagnosed with cancer, it is a devastating experience, not only for the patient, but also for their family and loved ones. So where does one turn to get the answers they need, and where does one go to get the best care available? Well, thankfully for the residents of the Upper Cumberland, that journey is not far, as there is a new cancer center, the Cancer Center at Cookeville Regional, that offers the best care available and a place to heal and to restore. Join us as we take a closer look at the Cancer Center at Cookeville Regional.
While we were able to provide very good care in our old cancer center, the new cancer center lets us do what we've always wanted to do, and that's provide a place for our patients that's warm and welcoming and spacious. We still have the same great staff, but we have a larger treatment area. We have a library area that's more comfortable for our patients as they wait, or if the family members want to wait while the patients are getting chemo, they have something to do and they can check their email and read a book and just relax for a little while. We have a boutique that we did not have in our old area that allows patients to buy things they may need during treatment, such as a mastectomy bra, nutritional supplements, anything that they might need. They could have one-stop shopping in our boutique. Our healing garden is certainly a big difference for us, and we're enjoying that very much. Our patients get to look out while they're getting their chemotherapy into a beautiful garden that was planted with them in mind, and they get to see the different colors and the changes in the scenery and really enjoy looking at that while their medicine is given to them during the day.
When I interviewed, I saw the old location where the practice was, and there was obviously news about the new building and the tomotherapy machine. I did get a chance to see it, and it definitely influenced my decision to see the ambience of the new cancer center with patient satisfaction as the main goal. So that definitely influenced it, and having clinical trials was a next big plus. My belief is we can handle 99% of different cases in the community, and that's where having the most sophisticated technology helps. So because we don't have to send the patients away to get these advanced treatments, so that is a big plus for the patients and the community.
Oh, they've just been wonderful. I brag on them all the time. We've just absolutely fallen in love with the nurses, and of course Dr. Jaquin. He wants to make sure that I can carry on my lifestyle the way I want to do it. And over the last year, we've done a lot of traveling, and he's made sure that I was able to do that.
And it makes us feel like a family, and it's really made a bad situation into a good situation, always looking for the positive outcome. And we really enjoy and appreciate the new Cancer Center and all the kind of things that they have done for us.
The new one, it allows the patients to spread out, and also with the garden out there, makes it a much nicer view. You have a better feel, and so we've enjoyed the new Cancer Center much better than the old.
A vital component of the new Cancer Center is a treatment system called tomotherapy. Cookeville Regional has only the second unit in the state of Tennessee. Dr. Sidris tells us more about this revolutionary machine.
With older radiation machines, we would bathe the entire area with radiation. With tomotherapy, we can deliver high dose to a defined area and spare normal tissues as much as we can. This increases our chances of a better result and decreases chances of side effects in the long run.
Started treatment about 3 months ago, and so far it's been very mild, and I come home from the hospital and I go right to work doing whatever yard work or mowing or whatever, and there's really no after effects.
It's not painful. There's no sensation. Our bodies are not designed to be able to feel radiation. That's why when you go out to the beach and get a sunburn, you're getting sunburn, but you don't feel it. So the treatment itself lasts anywhere from 5 to 10 minutes, depending on the location of the body.
I didn't want to travel to Nashville, and when we discovered the Tomo machine was here in town, that was our first selection that we went with.
Well, it's cutting-edge technology. There is only one other unit in the state It's unique in that a smaller community hospital would have the foresight and will to go ahead with cutting-edge technology that will become probably standard in about 10 years, but which is way ahead of the curve right now.
For patients who are interested in exploring new investigational therapies, Cookeville Regional offers a robust clinical trials program. Dr. Jaquin leads this initiative.
It gives us access to protocols that are written by nationally recognized experts and drugs that perhaps are on the verge of being released but not yet released. And they're sponsored by drug companies, so the patients benefit by having a new treatment available to them, and also the treatment is offered to them free. So it's financially rewarding as well as giving them the chance to participating in something that might benefit other people down the road. We can virtually offer a trial and any diagnosis, and if patients are willing to do that, we have a clinical trials nurse that work with them closely to make sure that it all gets done.
If a patient has exhausted perhaps standard treatment, then there's an option for them through a clinical trial that may offer them a new medication that isn't approved yet, which may benefit them in the long run for their cancer. Last year we received our SWOG affiliation, which is through the University of Tennessee, and what that does is it allows us to access clinical trials through the National Cancer Institute.
For breast cancer patients, a special person is ready to provide more than answers to questions. Meet Nurse Navigator Erin Young.
I'm the breast health nurse navigator, and basically I entered the woman's life when she's been told that she needs biopsy by the radiologist. That's when anxiety is really high, and we biopsy things by needle. Nowadays, about 90% of the time we can diagnose benign and cancers by needle biopsy, because the biggest part of anxiety is kind of, okay, I need a biopsy now, what is it? And so if I shorten that length of time with them by helping facilitate appointments and getting orders and making all the appropriate phone calls for them, then that helps shorten the time they have an abnormal mammogram to the time they get a diagnosis.
The cancer program at Cookeville Regional is more than just chemotherapy and radiation. Pathologist Dr. Jason Nolan explains the laboratory's role.
Whenever anyone gets a biopsy or has surgery, we get the specimen and we look at it and we tell them if it's what kind of tumor they have. If it is a tumor, it gives prognosis to the patient and tells them how they're going to do and what kind of therapy they need based on what malignancy they have. Since I've been here, I've seen the age of women with breast cancer decreasing drastically from what you would typically consider in their 6th to 7th decade, now coming down to 3rd and 4th decade. So I've definitely noticed a trend in earlier diagnosis of breast cancer.
The Cancer Center at Cookeville Regional not only has the accolades from patients, but also the official seal of approval.
Not only were we accredited, but we were accredited with commendations. So that's a special category that about 40% of accredited cancer programs achieve that level, and we were able to achieve it. The thing that makes it really special is the staff. We've got a really good group of people here working at our cancer center, and the patients do notice that right away.